if your shoulder is stiff or even painful, and you might have problems moving your hand behind your back, then you need to start this 3-exercise combo to get it fixed. You can skip the following short theory part with the help of the chapters down below if you want, but we recommend watching the whole video because the more you know, the better this will work. First, we will mobilize the shoulder joint and the muscles, and after this we will exercise the posterior muscles in an elongated position where the strength usually lacks in these muscles in these situations, and this will increase the mobility even further and stabilize the joint, and it will make the joint move better. In my clinical experience, the stiffness and pain that I mentioned before and difficulty of moving your hand behind your back or across is usually caused by the posterior capsule of your shoulder. So this means the ligaments, the myofascia, and the muscles in the posterior part of your shoulder tense up for some reason, and this causes suboptimal movement in the glenohumeral joint. So this means your shoulder joint. Usually this comes after an overuse injury or a tear in the rotator cuff or in the ligaments. This posterior tightness affects the normal gliding of the humerus in the shoulder joint, and this causes faulty loading to the shoulder joint and causes pain and restrictions. If you do tasks that demand internal rotation from the shoulder, you usually feel the pain. So, such as putting your hand behind your back, driving with your car, or getting your hand across your chest. And this also causes pain when you lift your hand up to grab something or lift something up. The first exercise is HBB mobilization, aka hand behind your back mobilization. So put your hand behind your back as far as you can without pain and without intense stretch. Then put the elbow against a clean wall. Unlike ours, you can even turn away a little bit and then start pulling your shoulder backwards like this. So this creates a stretch in the shoulder. Do this 1 to 2 minutes and dynamically. So pull it back and then relax. And no pain should be felt. But as I have noticed with my clients, sometimes people feel pain in the front of the shoulder while doing this. So in this case, you should try the next variant of this exercise. For this variant, you need a tight resistance band, and then you can tie a knot like Teemu did, and then you put it behind the door and slam the door like a boss. You can do it like that, or you can just attach it to the ovenkahva. Or you can attach it to the door handle. Now the resistance band comes in front of your humerus, so in front of your shoulder, not on your pectoral muscles like this, but more, but more towards your shoulder, because this starts to glide the humerus posteriorly. This lessens the pinching of the anterior muscles and tissues of the shoulder. So this puts the shoulder joint into a better position. Now put the hand behind your back as far as you can without pain. And then if you have orangutan hands like my friend over here, then you can grab the elbow and start to pull on it. Remember to come forward so that the band is pulling your shoulder back. And then start to dynamically pull your elbow forward. And repeat this 1 to 2 minutes. And if you don't have these monkey-like hands as Teemu, then you need another set of bands or a belt or something, and you put it around your elbow like this, and then you just pull your arm or your elbow with this band, and 1 to 2 minutes. Sleeper stretch on the wall. Lean into the wall, shoulder pulled down. Bring your hand up, shoulder 90 degrees. Avoid shrugging the shoulder up accidentally. Pull it back down. Don't turn away from your shoulder. Stay on the shoulder and perpendicularly to the wall. This doesn't let you to compensate the stretch with the parts of your shoulder that already stretch. So we are tackling the tight posterior parts. Then keep your elbow 90 degrees and push your hand down until you feel a slight stretch. You can keep it there or do it dynamically. It shouldn't be painful. If it is painful, you are pushing too much. Do 1 to 2 minutes. If you feel it still in front of the shoulder, the painful sensation or discomfort, then you can lower the elbow a little bit down. Now that you have mobilized your shoulder and it has gained a small amount of instant extra mobility, it is time for the grande finale. The third exercise is external rotation against the wall. And now you don't have to be perpendicularly anymore. You can turn away 10 to 20 degrees. Otherwise, this is the same position. Now use the force to hover a kettlebell, a dumbbell, or a resistance band into your hand. And then keep your shoulder in 90-degree angle and your elbow in 90-degree angle and start to lower your hand down slowly. This is the money-making part. Slowly, as down as you can, and until you feel a stretch, and as low as you can go without pain. And then if you can bring it up with your own muscles, then do it. And if you can't bring it up the whole way, then you can help with the other hand. You can also do the whole exercise eccentrically. So this means that the lowering part is the only active part. When the hand goes down, you can lift it up with the other hand. Pick a weight that is pain-free, and optimally you can do only about 6 repetitions with it. Keep 1 to 3 minute pauses between sets and do 3 to 4 sets of this exercise. This should be heavy and hard, but no pain should be felt afterwards, during this, or the next day. Meaning no extra added pain to the normal muscle soreness or symptoms that you have had. Now the stretching and mobilizing exercises should be done 4 to 7 times a week. 7 is always better. And the strengthening exercise should be done 3 times a week, and always leave a rest day between so that your muscles can recover. Also, remember to gradually increase the weight in the strengthening exercise when you get stronger, and if you want to get your shoulders really strong and stable, and if you want to get extremely tough rotator cuff muscles and a stable shoulder, then you need to add a few more exercises, namely those from that video. So see you there.